You know, it really feels a lot different today, doesn't it? We got balloons, we have three-dimensional people, we have people in the seats, we got music. It seemed like such a great start. I think, I don't know what it's like online, but I can see everyone behind these masks smiling today because something really does feel different, doesn't it? So great to be here at the Community Engagement Showcase. Just something about that word showcase, it just seems like we're in a special moment, right? You could have something in the showcase when you were growing up. And I was just looking through all the great talks we have upcoming, and it's an amazing breadth of work across community. And this is really about trying to collaborate with community to make better change, to improve our discoveries, to have a bi-directional, multi-directional relationship, and improve our understanding of human challenges and solutions going forward. And to just see this much work going on, you know, our school's roots in the 1930s were in Detroit, in the Detroit community. We're still very present there with much of our research and learning from each other every day. And it warms my heart to see all these talks coming up. So I'm not going to say much more, but just to say thank you to Dr. Shanks for all the work that you have done in organizing this and your team. And it's something special about today, I think. So have a great day.
And the next slide, I have an opportunity to introduce you to Engage. Many students weren't here when we made our formal introduction. So I'd like to start by introducing the team. So as I said, I'm Trina Shanks, and we have three staff, I guess is the way to say it. So Sonia Harb, Ayesha Ghazi, and Fatima Salman. And we have three student interns. So we have Cleo, there she is, and Leslie and Annika. And Annika just started about a month ago, so this is one of her first real events. So thank you all for your help as student interns and field students. And so I guess you see on the back, because I can't see it, but Engage really is here for the school to show student and faculty engagement within the community, but also with a particular focus on addressing social injustice and promoting social justice, and then facilitating student learning and supporting community engagement efforts across the school. So some students, even before they came to school, were already active in community engagement, so it's a way to continue. Some students, when they get here, when they're in class or field, have an opportunity to start working in the larger community. We have faculty who, because of their research interest, either do short-term small grants or build long-term relationships. We have staff. Everyone is doing things in the community, so it's a chance to celebrate it today. Next slide, please. But before we get to the celebration, I want to give people a chance to understand a little bit about our Engage team and what we try to do here in the school. We uplift current community engagement and facilitate more and intentional engagement. So we want to support the things that are happening and then encourage more things to happen in a more sustainable way. We coordinate community engagement across units, centers, and courses within the School of Social Work and across the university. So if there's someone in the School of Public Health that's doing community engagement and would like to have social work involvement, if there's someone in the School of Public Policy that's doing community engagement like social work involvement, or if there's a new idea that people want to collaborate on, we sometimes are a starting point to have that conversation within the school. And then we also want to facilitate community impact, so whatever is going on, so it can have the most impact as possible. Next slide, please. And so when we think about how we engage inside the school, we promote and showcase faculty and student engagement, which one of the things we're doing today. We do an inventory map so we can see physically where all the engagement's happening, and ideally, when there's nodes of strength, we can help coordinate across topic areas and or geographies. We issue small engagement grants, so usually in the fall, we award 4 to 5 grants, and you'll get a chance to meet our new grantees later on today in the program. And then when it's relevant, we try to implement curriculum innovation. So if we want to have more community engagement in the classrooms, if we want to introduce faculty who want to have community projects, if we want to have a credit that emphasizes community engagement, we kind of help do that internally within the school. And then in terms of externally, We connect social justice movement to the schools. So there's people doing great social justice work in the community, people who are taking charge and responding to new things that are happening in the area. We are able to introduce those folks to the school through our webinar series and just through email and other types of introductions. We facilitate community-based social impact initiatives. So if they're long-term things, for example, we're doing work around equitable employment and equitable housing, and we kind of keep those conversations going with people in the community and people inside the school. And then we provide technical assistance and support to community-based organizations. So sometimes that's just answering questions. Sometimes that's introducing them to expertise within the school. Sometimes it's doing case studies so they can document and promote their work. Sometimes we either help do evaluation or connect them to groups like PEG, which is the Program Evaluation Group, to help with evaluation. You'll learn more about that in a little bit too. But whatever ways, if people connect to us, if we can't as a team do it, we try to connect them to resources across the school and across the campus to make that happen. Next slide, please. Oh, icebreaker. So our student interns are going to do an icebreaker, so please come up and give them a hand.
All right, everyone. Thanks for introducing yourselves to folks in the room. Before we end this little icebreaker moment, if you'd humor me in just taking a breath and settling into a more what is this conference kind of space. So just wherever you are, just empty your stomach of air. Breathe in. Slowly release your breath when you're ready. Thanks.
Thanks to Annika and Leslie for leading that lovely icebreaker. It was good to talk to each other, right? And so I would like to ask the student panelists to come up and take a seat at one of these chairs. If you don't know who you are, it's the Detroit Initiative, the Capacity Building with Alliance, Audrey Montgomery, Youth Advocacy Project, Brittney Barros, Michigan Liberation, Nick Buckingham, Collaboration Cultural, Responsible Suicide Prevention Programming, Lauren Wright, and Gynecological Care with the Transgender Nonbinary Community, Flyn Alexander. So is that everybody? All right. Awesome. So we have this wonderful panel of students who submitted ideas about what they've been doing and what they're excited about around engagement. And so we've asked each of them to talk for 3 to 4 minutes, so it's going to be fairly short. And we have timekeepers if you go way over. But it's a chance for you to just, first of all, introduce yourselves and say a little bit about your project, and then we'll go into some Q&A. So I guess we'll start with the Detroit Initiative down there. So please, go ahead.
So good morning. Yes, still morning. Good morning. My name is Stephen Herrod.
I'm Arim Lee.
Yep, so we are here to present the Detroit Initiative. The Detroit Initiative is actually an initiative of the school, the University of Michigan. It's located within the psych department, and it's a service-based learning course for undergrad students. Regardless of their passion, they can take this course, and the actual course code is Psych 325, and this semester is focusing on empowering youth and families. So there's a classroom aspect of it, which is located, of course, here at the school, but then there's a service learning aspect of it, which is in Detroit. And the idea of it is the students basically go through a classroom aspect where they learn theory, models, and other things, and then they weekly go to Detroit. They travel to Detroit at a community-based organization, and there are different community-based organizations that the school is partnered with, and they have a service learning aspect of it. And from the time of the beginning of the semester to the end of the semester, different things are tracked to see how the students have progressed and learned as it relates to having that service learning aspect to their course. So I'll pass it over to Arim to give us a
Yeah,
little bit more.
so our, you go to the next slide. Okay, so our community partners for this semester are Gleaners Community Food Bank, Bailey Park Neighborhood Development Corporation, America Reads, and Cass Community Services, and these are all community-based organizations in Detroit and their surrounding neighborhoods. And right now, so there are two different client populations that we currently work with in the field work, which are obviously the students, the undergrad students who are learning in their classrooms about different theories, different models, different ways to be able to apply their learning skills in the work that they're doing at the community sites. And then we give the community sites autonomy to determine what kind of projects the students can work on throughout the semester that will benefit the students' learning, but also benefit the community that they're serving. I guess our role as the MSW interns, we bridge a lot of the communication gap between students and the community organizations. There's some organizations that we have lasting relationships with and others that are brand new, and we're developing those relationships currently. But one of the main things that we try to kind of hone in on is getting feedback from both of our client populations of the students and the organizations, so that every year we can kind of utilize that and analyze the data and improve on the service work and the relationships that we're building with the communities. And so and so that's kind of the community work that we're trying to build with the school and with the organizations.
And so our next project is the Capacity Building with Alliance, Audrey Montgomery. Please welcome her.
All right, hi everybody, good morning. I'm so grateful to be here and presenting to you all and getting to hear from my fellow colleagues and peers about the amazing work that they're doing. My name is Audrey Montgomery. I use she, her pronouns, and I'm a current advanced standing MSW student in the global social work as well as the community change pathway. Today, I am honored to showcase a unique project that's an extension of the work being done through the Justice Future Participatory Action Research Lab. Those involved are myself, as well as my fellow MSW candidates Ella Imes, Shaylin McKinnon, and Wendy Liu, as well as PhD candidate Irene Rout, and faculty members Professor Odessa Gonzalez and Professor Ana Paula Pimento-Walker, who are all joining us virtually today, so hello to you all. The research project goals include the following, which you can see up on the screen. The first is to identify, document, analyze, and disseminate refugee community organizations' role in supporting the refugee community during the COVID-19 pandemic, as well as to build the capacity of these organizations via workshops, trainings, and truly just more of a collaborative, reciprocal, co-learning, hands-on method. The third is to build coalitions and partnerships, and the last is community outreach. So over the past year, next slide please, the team has interviewed, collected data, and built long-lasting relationships with several refugee-led organizations across the state of Michigan. All this was done with the goal of documenting the organizational life of immigrants and their functions in order to strengthen the legitimacy of these organizations and their actions to advance equity and inclusion for their immigrant communities. So as part of this ongoing work, the research team has been working closely with one particular organization, Alliance, that I would like to highlight today, who are also joining us virtually from Grand Rapids, Michigan. All this, it was started by leaders from the Benya Malenge Congolese refugee community. Their mission statement is up on the board, which is, we empower all immigrants and refugees to adapt to their new life in the USA by providing direction and orientation in their daily life. The research team has implemented capacity building strategies and have worked alongside Alliance over the past year in aiding in the formulation of a name, a mission statement, establishing themselves as an official nonprofit by gaining their 5013C, applying for grants, building a website, brainstorming ideas for the scope of the organization and the services that it can provide, event planning, and so much more. I would like to highlight one event in particular. So as part of the organization's kickoff, Alliance decided that their first event as an official entity would include a COVID-19 vaccine clinic, where they partnered with a local health department in Grand Rapids, Michigan, to provide translated information on the vaccine, as well as providing on-site vaccines for both COVID-19 and the flu, refugees and immigrants are disproportionately affected by the COVID-19 pandemic. The widespread misconceptions and the lack of access to translated information, as well as the means to get a vaccine, inspired Alliance to provide this program. And that day, nearly 100 community members received a vaccine, as well as many more receiving translated, reputable information from the local health department. Yeah, cool. Thank you. This event was a huge success, and actually we just found out a few days ago that we're now able to do 8 more over the next few months at local churches. So we're really excited to get that going. It also illuminates the potentials of the reciprocity process our team has and continues to prioritize in our work. So overall, as a team, we are grateful to be a part of the capacity building process with Alliance and are eager to spread the word about this organization and its immense impact on our local refugee, immigrant, and new American communities here in Michigan. Thank you all.
And if Brittney Barros can come up, she's going to talk about Youth Advocacy Project.
Good morning, everyone. My name is Brittney Barros, and I am a current MSW student here at the University of Michigan. Today, I am going to be talking about my project with the Michigan Supreme Court, State Court Administrative Office, Child Welfare Services Division. Long name, I know it has the whole alphabet in it. So today, let me talk to you about a project that I'm doing through my field placement that is near and dear to my heart as someone with both lived experience and expertise in foster care. Research has shown us time and again that youth are not engaged in their court hearings related to their foster care cases. Oftentimes, their voices go unheard or unseen, and big life-altering decisions are made about them without them. So what is the cool and unique thing about this project? As someone with lived experience in foster care, I get to be a peer support mentor as I contain critical knowledge of what it means to survive the foster care system. I get to help youth advocate for themselves, learn about laws and policies that impact child welfare, as well as encourage and strengthen their ability to advocate for themselves. So what are the objectives of the Youth Advocacy Pilot Project? Next slide, please. The first objective is to increase child attendance at court hearings and in important decision-making processes. How we do this is we created a youth-friendly court notice for all of our participants, and we keep track of who is participating in their court hearings from the youth-friendly court notice to the youth. The second objective is we engage meaningful participation by ensuring youth feel welcomed at court. Again, the cool thing about my role as a youth advocate, as the name may suggest, I am not there to advocate for the youth. I am there to encourage and uplift them to advocate for themselves. The third objective is to enhance judicial decision-making to improve permanency outcomes. We do this through tracking court orders versus what the youth desires, and we compare to see if permanency outcomes are increasing for youth. And finally, we build tools and resources for youth to promote self-advocacy, as well as awareness about laws, policies, services, and community resources. The one cool thing about this project is we pay our clients to participate in our webinar trainings. And we teach them, like I said, self-advocacy, community resources, and just how to effectively advocate for yourself. And as a youth that has experienced the foster care system, it's critical to make sure that my voice and our voices are represented in the judicial process. Thank you. So I will end with this quote: "Nothing without me, nothing about me without me." Thank you.
So next, I invite Nick Buckingham to talk about his Michigan liberation work.
Good morning, everyone. Peace and love, and as we say in Detroit, what up, though? What up, though? There we go. I knew we was gonna get it on this morning. My name is Nicholas DeFell Buckingham. I use the pronouns he, him. I am the co-founder and campaign director for Michigan Liberation. Michigan Liberation was started in 2018. We're a statewide organization. We're a 501c4 and a super PAC. And when we created this organization, we went in with the ideal of how to dismantle the criminal justice system by increasing the leadership development and formerly incarcerated folks. So myself, I am formerly incarcerated. I spent close to a decade incarcerated here in Michigan Department of Corrections, where I had an opportunity to see how horrible the conditions within our prison systems and our jails are. And according to their mission statement, they're not doing exactly what they're supposed to be doing. Next slide, please. When we started Michigan Liberation, we started to look at the root cause of crime. And I'm pretty sure many of us have these conversations about poverty, the lack of education, the lack of resources from government, from education, so forth and so on, and wanted to organize our community to have these strategic conversations of how to pull resources together, how to pull those resources together to support those that are coming in and out of our criminal justice system, and to make significant changes, not only in our community, but also in our carceral systems. In 2019, next slide. In 2019, we started a program called the Michigan Black Mamas Bailout. And what this is that we organize our own money. We raise our own money, no foundation dollars except for Colin Kaepernick. Shout out to Colin Kaepernick. But we were able to raise around $30,000. We started a court watch program with students at the Law School of University of Michigan and started to do court watches, seeing what was going on, how our judges and prosecutors are behaving while they're inside of these courtrooms. What we saw was horrible. The data that we collected was very horrible. And one growing population that we've seen that is not spoken of is black women. So black women is the fastest growing population today inside of our carceral systems. You will see more women that are incarcerated inside of our jails that are stuck there because of bail. And on an average, if a woman is locked up for about 15 days, taken away from their family, away from their children, away from the resources, these women are losing their jobs and the opportunity to have, the successes in their education and in their lives. So we started this program in 2019. It's still going strong as of today. We just had our first meeting yesterday and is looking to launch the next Black Mamas Bailout next week. Thank you. With that, along with the Black Mamas Bailout, we started to do a lot of work around prosecutorial accountability. And so we focused on 4 counties, Oakland, Wayne, here in Washington, and also Kalamazoo County. Out of those 4 counties, we had an opportunity to flip 2 of them. So Oakland County has a new prosecutor. Here in Washington, you all have 2 new prosecutors up under Victoria Burton-Harris and Ellie Savitt. Why prosecutors? The most powerful person in the criminal justice system, right? Since we have started that, they have opened up conviction integrity units. There has, up under this campaign, there has been about 30 people that have been released and given a second opportunity who was supposed to die inside of prison. These people were once sentenced as children, 14 and 15 years old without parole. So please, next slide. These are all of our active campaigns. Love for you to join our base, join our team, and learn so much more about us. Check us out on all social media platforms up under Michigan Liberation and the Michigan Black Mamas Bailout. Thank you.
Our next presenter is Lauren White. So if you can come up and talk about your work about suicide prevention programming.
Halito Chimichukma Tahachifayat Lauren White. Hi, my name is Lauren White. I use she, her pronouns, and I'm a citizen of the Choctaw Nation of Oklahoma. And I just want to say, typically with Native introductions, it would take me the whole 4 minutes just to explain what I was talking about in Choctaw, my family, my relations, the relations I have here. I see a lot of people in the audience that I've been in classes of, and so please be very aggressive with your reminders. Brevity is not my strongest suit. So I want to share today about work I've been honored to be a part of in the last couple of years with my training under Dr. Lisa Wexler. Dr. Wexler does suicide prevention work with Alaska Native communities, and my research focus is suicide prevention work that centers Native knowledge as a way of transforming mental health in rural and indigenous communities. And our community partners as part of this work, which has been going on in rural Alaska for over 25 years, so I'm probably not going to be able to name all of them. But our big ones right now are Manilik Foundation, Coeric. We work with University of Alaska Fairbanks. Diane McAkron is one of our main curriculum developers from there. We're funded by the National Institutes of Mental Health, by SAMHSA. We work in partnerships with tribal organizations that get Native Connections grants, which are also federal grants through SAMHSA. So this project is ongoing in multiple different communities with different leaders according to where you are geographically. And I really want to be sure to represent that we've got this team. This is our core team, represented by Alaska Native practitioners like Roberta Moto and Tanya Kirk and Josie Garney, and then also researchers here from the University of Michigan, from the University of Massachusetts, and a few other institutions as well. Okay, I think I'm ready for the next slide. So this partnership that we're doing is mostly centered around an intervention that we call PC Cares. This stands for Promoting Community Conversations about Research to End Suicide. An important context about suicide in Native communities is that there's a huge disparity for youth suicide in particular. So in some of the Alaska Native communities where we're working, the youth suicide rates are up to 18 times the national average of the United States. And also, this is a really new disparity. So 50 or 100 years ago, this was not something that was ever heard of in Alaska Native communities. And our research shows that this is really stemming from forced economic, social, and cultural change as a part of colonization. So we start our intervention with an understanding of that. And it's a core part of how we connect with different Alaska Native folks to work on suicide prevention. So functionally, what does PC Cares look like? We run a series of learning circles that are taught by local facilitators where we share tiny bite-sized pieces of information about research on suicide prevention. So one good example is safe firearm storage. We know that when you store your firearms more safely, you increase about a 10-minute period of time that you need to access firearms. That risk of death by firearm is extremely reduced. So we would come into a community, train facilitators, and then they would go into the community and host learning circles where they would share just this one tiny piece of information. And then really critically, we spend the entire rest of the time in our training talking with local people of what they think about that information and what they want to do about that information. So all of the action that happens after those learning circles occurs is entirely driven by local communities bringing in their knowledge about how things will work in their community and how they want to move forward with that information. So really trying to balance Native knowledge and Western knowledge and work together in an engaged way to end suicide in this region. I got 30 seconds, so I want to make sure I say any other critical things. There's so much more, but I would really love to talk with any of you more about this work. I'm in the process of taking all this training I've learned and moving into other Native communities, places where I'm from in Oklahoma. We're working on adapting this also for the autistic community. We're working with folks in Uganda. So we're thinking of this as a very flexible process of engagement, especially for communities that have trauma around their knowledge not being honored in some of these mental health spaces. So okay, thank you so much. And I'm really happy to be here.
And last but not least, we have Flyn Alexander to talk about gynecological care within the transgender and non-binary community.
Hi, everyone. Wow, y'all are tough to follow. Nice job, presenters. My name is Flyn Alexander. My pronouns are they and he. I like to say that I lead with they, but he is okay, interchangeably using both. I am an intern at Corktown Health, as well as an MSW student. I graduate in spring, so shout out to all the graduates. We're almost done. We're almost there. Really exciting. So I had the privilege of getting brought into a project the minute I started at Corktown, and that was with my supervisor, Jay Fallon. He was working in partnership with the University of Wayne State University to do a training to their med students. So the training was geared towards gynecological care for trans and non-binary folks. We know that community I'm a member of that community, and I've had personal experiences with that care, and it's not fun. So that care still remains pretty gendered and pretty binary in a lot of facilities, and they're not using informed consent models, which they could be using to really improve care for trans folks. So the goal was to really educate these students. They really wanted this, they asked for it, and so we provided it and kind of geared it towards their desire to learn. So it's very participatory. And so I wanted to add an element of like a survey. I wanted to get the more trans voices. I've done a lot of workshops and I've been the token trans voice in these conversations a lot. I don't want to do that anymore. I would like to bring more voices into the conversation. So I surveyed about 50 other trans folks and got their take on their experiences with gynecological care. And we incorporated that into our presentation. We presented this in October. It was recorded, and so there were over 100 med students in attendance. So it was a really big deal. And so we ended up recording that, and you were using that recording in ongoing trainings. So that recording is continuing to be used. And I got the chance to kind of analyze that data and really pulled some things that I wanted to share with you all today that I think are really important, that we also shared in our workshops. So one of the things that we learned was 50% of our respondents were non-binary identified. So that tells us that we really do need to break down this binary process that we see in the medical community. 53% of those respondents identified as queer. So there's some sexual orientation questions that folks ask that they need to ask to get the right testing and give the right care to folks, but we need to be more mindful about how we do that. And then another thing that we learned too, some themes we found from our research, was that folks are really scared about microaggressions. There's this fear of discrimination that can be even more daunting than actual experiences of discrimination, and it gets minimized. So a big focus for us was really defining gender dysphoria and bringing a mental health focus, because Corktown Health's whole thing is about mental health providing, but full service care. And so we really wanted to emphasize the mental health piece, because there's a lot of misunderstanding about dysphoria, and there's this focus on distress in the medical community, comes from the definitions of how gender dysphoria is defined by the DSM. So we really troubled that. We really wanted to look at that and kind of expand what it means, what this experience for trans folks is, and a huge portion of that is about gender euphoria as well. How do we create a euphoric experience for trans folks? And a big takeaway for us also was encouraging folks to create a space that's more inclusive forms, really using that informed consent model to get folks involved, trans folks involved, and center them in the process. So that's my project. I'd be happy to talk to folks if you have any questions. Thank you.
Wow, give all of our students a hand. What great work. So we're going to take 5 minutes for clarifying questions. And then there'll be time at the end to actually have more in-depth conversation. So if there's any kind of clarifying questions you have of any of our presenters, please come to the mic and ask.
Does this thing work? Oh, it works. Yeah, Michigan Black Mamas Bailout. You can Google it, Facebook it, it's everywhere. It's known. I did put my email and info. We do respond to the info at My Liberation, so it's not a dead account. And I do plan to next week, hopefully, I can do a presentation on the full Black Mamas Bailout up here at the school. I'm also part of the Black Radical Healing Pathway student organization, and we're going to couple some things together to make sure that we're getting the information out of our efforts and what we're doing.
So just one thing to say, if he hasn't made it clear already, Nicholas is the coolest kid in school. He really is. He really is.
Question for Flynn about the recording that you mentioned. Is that available, and how do we access it? I have plenty of people that need to watch that.
Awesome. I'm happy to share it. I need to get approval. I'm not sure who owns it between Corktown and Wayne State, but I'm sure they would release it.
Okay.
Yeah, so
I can contact you separately.
yeah, give me your email.
Thank
We'll
you.
definitely make it happen.
If anybody else wants to say about how to get involved, or if there's any final questions, if not, anybody else on the panel want to say something about getting involved, please. Lauren?
Yeah, you can find out more about PC Cares at our website, which is pc-cares.org. And there's also our research findings with lots of information about what we're noticing and the change that we're seeing in the communities too.
And it looks like Nick has some literature, so please come after him and you could get one of his flyers.
If you'd like to know more about Alliance, the organization that I talked about, I put our website, brand new, just went live a couple weeks ago, up on the screen, alliancegr.org. GR stands for Grand Rapids, to find out what they're doing and learn more about the services that they provide, and those upcoming COVID-19 vaccines that I mentioned will definitely be posted on their website. So feel free to check that out and see the amazing work that they're doing.
Any other panelists want to say a quick shout out or information?
I would just like to shout out Dr. Joseph Ryan. I know he's not here right now, but I'm pretty incompetent about data collecting, and he's been very helpful on like the methodological process of data collection with my project. So just a quick thank you to Dr. Joseph Ryan. Thank you.
I just wanted to say one kind of overarching thing is how much do we learn when we're in the community, how important these opportunities are, you know, to make sure people have access throughout the MSW program to need opportunities to get out there and be with people in the community, learn from them, collaborate with them. You'll remember, I'll remember these talks, and these are going to be such incredible touchstones over your entire social work career. I just want to say there's nothing like doing the work and being out there. It's really tremendous. I really enjoyed it very much.
All right, with that, if our panelists will return to the audience, we'll go to the next part. So you've heard a bit from our wonderful students. Another thing that happens in the school is we teach, and there's things that happen in the classroom. So the next two panelists will talk about examples of community engagement in the classroom setting. So I will introduce them both now, and they will speak as they will. So Ayesha Ghazi Edwin, who you've met before as part of the Engage team, but she also teaches at our school, and then Carrie Rheingans. So the two of you, please talk about what you do in the classroom.
Hi, good morning, everyone. I don't know if this is on. I think it is. So I'm a lecturer here at the school. I'm also part of the Engage team, and I'm an Ann Arbor Human Rights Commissioner. And about a year ago, I was teaching a 560 class, and I decided, how can I get students involved in learning how important local policymaking is and how much change you can make at the local level? And how can I get students involved in understanding how current issues in our city are connected to historic problems, like, you know, redlining and housing problems. And I also wanted to give them kind of a taste of community-based participatory research, that you have to go to the people affected by the issues to really find the solution to those issues, right? And I also wanted to give them experience with kind of looking at a problem using a strength-based, asset-based lens. So if there's an issue in a community, there's also a lot of strengths, and how do you use that to find a solution? So I went to the chair, and you can go to the next slide. I went to the chair of the Ann Arbor Human Rights Commission, and I said, what are some issues, policy issues, that we need help on? That if we had research on, we could make ordinance changes on. And she gave me a few. As this slide shows up here, you know, Ann Arbor does actually have a lot of issues. We're an exceptional place to live, but we're also one of the most economically segregated places in the nation. We're also now becoming one of the most racially segregated nations cities in the nation. And there's a bunch of other stats here. So she gave me a few topics. She said we need more information on undocumented immigrants in the community, on housing for people who are formerly incarcerated, on our complaint process and whether it's equitable, how people file a discrimination complaint with a city, and various others. There was 10 topics total. And across 2 sections of 560, I did 5 groups in each class, and each group picked a topic. I don't know why that math was so hard for a second. But so I think you can go to the next slide. So the project was broken up into 3 sections. So the first was a paper, and let's say that you were looking at unaffordable housing. It was about the history of unaffordable housing, so it looked at racial covenants in Ann Arbor and the legacy of redlining, connecting it to the current context. So it also had demographics and statistics about what housing inequity looks like right now in the city. And that involved them also going to someone who was impacted by the problem or working on a solution. The second part was a paper proposing a solution. And that was something else that I wanted. Another thing I wanted students to get experience with was looking at different examples of policy solutions in other municipalities around the nation and helping to use that to inform our policymaking here in Ann Arbor. So they did that. And then the third was a presentation. So all the groups presented to select members of the Ann Arbor Human Rights Commission, and then 3 groups were selected to present in front of City Council. And those 3 groups were reforming the 180-day complaint process, fair chance housing or fair housing for people who have a criminal history, and unarmed response, mental health and policing. And they ended up having, and these are some screenshots of their presentation in front of the human rights commissioners and the city council members, and they were amazing. And they ended up actually leading to some real tangible changes. So the complaint process group basically came to us and said, you guys have a limit on how long someone can file a complaint for discrimination after an incident happens. It's 180 days. We learn in the social work school that's not trauma-informed, and it's probably preventing people from coming forward. So we changed an ordinance. We passed a new ordinance, and we took away the 180-day limit. Then a group came, and they said, we have this research about, and this was the unarmed crisis response group. We really need to have I have 30 seconds. Anyway, they helped to contribute to unarmed crisis response using the Cahoots model, and there were other changes too, and it was wonderful and amazing, and I'm really appreciative of them. So that's the end, and yeah, reach out if you have any more questions, and the students actually made changes around policy this year.
Good morning. My name is Carrie Rheingans, and I am a lecturer here at the School of Social Work. I have a full day job elsewhere, and I am teaching this brand new class, Social Work 649. It's a practice class for students to get actual hands-on practice doing policy skills. Next slide. So the students, I had been following the Ann Arbor City Council policies very closely. At the time I was planning this class, I was a candidate for Ann Arbor City Council, but I'm not anymore. I've decided to run for State House instead. Okay, thanks. Thank you. But the students, since this is a brand new class, it's 1 credit. They only meet 5 times over 6 weeks. Normally, we have 14 weeks of class, and I ask students, what are you interested in? Let's tailor your project to what you're interested in. We did not have that time. So I said, here's what you're going to be interested in, but there's things that you can influence right now in the next few months. So we picked topics for the students in the first half of the semester, and I'm teaching this class again. We just had our first class last night, and we formed new groups. In this class, the students got a chance to practice policy skills like interviewing people who are affected by the policies that exist or would be positively impacted if we created a new policy or changed a policy. They got to practice policy skills like making a podcast to educate people. They got to practice policy skills like designing a plan of how are they going to do advocacy to get some policies changed or implemented. Elected officials, one of their major job responsibilities is making decisions about how tax dollars are spent. That is, some might say, their only job. And even if they pass resolutions, they're spending, on issues, they're spending that time, that taxpayer-funded time, addressing that issue. So it shows it's a priority. So some people might argue that that's their number 1 job. So some of these policies were actually giving recommendations to the Ann Arbor City Council about how to spend major amounts of money that are coming to our community. Opioid settlement funds and the American Rescue Plan Act funds. So students worked on those and provided podcasts. 4 out of my 5 groups first half of the semester did a podcast for the first time. And they ended up publishing a podcast with a transcript and references, and I've shared those publicly. The students gave permission, and it's been circulating to influence the local discourse about what decisions might be made at the City Council. So I do have these available online. They're on the A2 Council hashtag if you look on various social media platforms. The social media platforms highlighted here. And some students made images to accompany their recommendations and findings, but you can find these and listen to the podcast yourself or read the transcripts. But I do want to leave you with just one comment from a student's reflection. So at the end of just 6 weeks of this policy practice class, in the final reflection, one of the students reflected on how policies affect everybody, but not everybody gets a chance to influence the policy because they're not asked, nobody reaches out, maybe they try and nobody's listening. So I thought that was a really great reflection from one of my students in the first half of the semester. And it's actually going to be kind of driving a little bit how I think as I campaign and hopefully serve in an elected role. So that's just one example of how we can bring the students into the community and make sure that we really influence policy in our own community.
Thank you, Ayesha and Carrie. That's excellent work. I guess, again, if there are any clarifying questions, a quick follow-up that you want to ask of Ayesha and Carrie, take a moment to do so now.
I actually want to just share because I did not get to. One of the contributions of one of the groups led to an ordinance called the Fair Chance Housing Ordinance, which prohibits landlord discrimination against people who have a former criminal record. There's just so much that they did. It's hard to in 3 minutes say it all. But bottom line, the students I think really understood during this class the impact that local policy making can have and how important it is just to get involved. So yeah.
And one other thing that Ayesha didn't get to say is that she is also running for public office for Ann Arbor City Council.
Yeah.
So if you live in the city, look her up.
And this project had a part in influencing me to do that. So yeah.
All right. Well, thank you both. And so in addition to our great students and our great classroom activities, we also have faculty that do research. So I'd like to invite Lisa Greco to come up and talk about our program evaluation group. And she can say a lot more than I do, but again, rather than just one-off projects, it's a service that our school offers to the larger community. So I'll give her a chance to say a lot more about that. Lisa?
Hello? Oh, lower the mic. Just want to say, first of all, thank you to Dr. Shanks and the team for providing an opportunity for us to say a little bit about the program eval group at today's showcase. PEG, I'll call it PEG, the program eval group, is a service unit here at the School of Social Work and is one of the examples of the school's commitment to community engagement. So classroom, we learn a lot about theory, and then practice comes into play for our field placements, and then also at the program eval group where we're doing community-based evaluations with community organizations. Beautiful. Our unit is led by Dr. Shauna Lee. Maybe some of you have had her for your classes, and also really co-directed, only a little bit against her will perhaps, founding director of PEG, Sue Ann Savis. You may have had her as well, faculty member here. And then we have 3 staff evaluators who are professional evaluators with the skill set to perform evaluations in the community. And then we have 6 student interns, so MSW students here at the School of Social Work who are working with us. They're in the macro pathway of research and evaluation, and so it's one of the ways that we're bringing really social work values into evaluation in the macro pathway here at the School of Social Work. So a little bit again about PEG. What we do is we partner with community organizations, public and private, to provide training and evaluation services, data services, and also simultaneously, because of our work with MSW student interns, training the next emerging professionals in evaluation and social work, carrying our social work values into evaluation. As social work evaluators, as you know, we have a particular lens as social workers, and then as social work evaluators, we carry that lens into our work with evaluation in the field. So utilization-focused capacity building, what we're talking about there is if it's not useful to the partner that we're working with in the community, it's not work that we should be doing. So utilization-focused means if we're going to do an evaluation that's going to sit on a shelf somewhere, we ought not be doing that. So we really partner intentionally with our community partners around making it useful to them, useful, and then as well sustainable. Beyond our engagement, so that they can carry on the work beyond our engagement. Centering equity, as we know, all of our work really needs to be grounded in structural contexts, and evaluation is no different. So we bring an equitable evaluation lens to the work that we're doing in the community, and partnership-based, really prioritizing the experience of those who are doing the work in the community and those with lived experience in every part of the evaluation process from beginning to end. We have about 20, watching my time here, we have about 20 active evaluation projects right now in the community, large to small. One of our largest is a 5-year project around food system sustainability, the Double Up Food Bucks program. You may be aware of that program. We're working with Fair Food Network to evaluate that program. And then on the smaller, simpler end of things, we're working in Detroit with Urban Neighborhood Initiatives on an evaluation of their youth mental health services program in the Springwells neighborhood in Southwest Detroit. And that's a little bit about the program eval group.
If there is a clarifying question that someone, please.
Good morning. A couple days ago, I was looking at the School of Social Work website, and there's actually a 6-module eval applied research modules where you can get a free certificate in program eval and research. I'm just curious if that was through you guys, and if you could, if it is, you could explain a little bit more about that 6-module online class.
Are you referring to the? Is it the modules that are in our webpage? Yes.
It's a self-paced learning module for evaluation and research.
Oh, actually,
Continuing ed.
It's through continuing ed.
Oh,
Okay.
so it's someone else.
Excellent. It's through continuing ed. I'm kind of glad that you brought that up, though, because in addition to the certificate program through continuing ed in eval, there are also 6 on the program eval group webpage. There are also some free webinars available on basic evaluation skills, so less intense than the certificate program, but also available to you for free on the website, on the program eval group website as well. Thanks for bringing that up.
Yeah, thank you.
Yeah.
So in addition to our great students and what goes on in the classroom and our program evaluation group, which is services school offers, yes, I will. So our Engage team every year offers a small grant program. So we do it in collaboration with the School of Public Health and the Detroit Urban Research Collaborative, DURC. And so we want to kind of announce, because it's going to go Friday news today, I think, all the winners for this semester, but 3 of them are here to talk to you today about their projects. So I'd like to invite Ashley, Beth, and Christina to come up and join the panel to talk about their small grant projects that they intend to do because they just are getting the money right now.
Hello there. Oh yeah, I'm a smiler. Okay, yeah. You gotta see it. All right, so good morning. As stated, my name is Ashley Cureton, and my pronouns are she and her. I am a new assistant professor here, so if some of you are like, who is she? You didn't know me. I just got here. So I'm excited to be here at the School of Social Work, and it gives me great pleasure to share the project that I will be embarking on over the next year. It is in partnership with the Jewish Family Services of Washtenaw County, or JFS, and it is entitled, Welcome to the Motor City, Exploring Refugee Resettlement Among Afghan Refugees in Detroit and Beyond. So unfortunately, as you can see, it's just me. My partner, Dr. Shadin Atiyeh, was unable to make it because she's in the trenches working with newly resettled refugees today, and she couldn't make it. But I do want to thank the Detroit Community Academic Urban Research Center for funding this project. And so, did you know that some of the lowest number of refugees were admitted to the U.S. during the Trump administration? According to the State Department data, for fiscal year 2018, the annual refugee cap was set to be 45,000. Ultimately, a little over 22,000 refugees were resettled. In contrast, President Barack Obama set the cap to 110,000 in 2016. In the 7 months since the Taliban entered Kabul, taking control of Afghanistan, the United States has resettled
or welcomed 74,000 Afghans who were forced to flee their country. The Biden administration has been intentional about resettling more refugees. But as you can imagine, this has taken a toll on the resettlement agencies. They went from not resettling many refugees to now resettling the influx of 74,000 refugees. Michigan has resettled 1,300 as of last month. And so the goal of this partnership, and it's, well, I'm new, right? So I wanted to build collaborations and partnerships with not only JFS, but a lot of organizations in Michigan, is to, one, with JFS serving as the anchor, it is our goal to understand the current changes to the refugee resettlement process by engaging staff and community stakeholders across various refugee resettlement agencies in Detroit and Arbor and cities throughout Michigan. We are interested in understanding how these agencies can adapt to the swift influx of Afghan refugees and others, right? Ukraine, that's happening in the world. There might be an influx of refugees from that group as well. And so we want to understand the best practices and lessons learned from what has been done the last 7 months. And then secondly, we want to learn from the folks, from the Afghan refugees, about their actual needs. What are the mental health, housing, employment, and education needs they need upon resettling to the U.S.? The goal in this project, it was spearheaded and led by the needs of JFS. And so our goal is to not only do this project and to share it with the U-Michigan community, but to have community meetings, community dialogues, and to share our findings with the broader refugee resettlement agencies and refugee communities who've been directly impacted by this work. Thank you so much.
Beth Glover-Reed is the next presenter, so please come share your small grant project.
Okay, she has a lot more energy than I have. So this is actually the second grant we got from the Detroit Urban Research Collaboration and the school. And the first one was for a coalition formation, a project formation grant. And the second one is actually to implement a project that came out of that first one. So these are the partners. This is a coalition of 8 LGBTQ plus focused organizations. And SAGE Metro Detroit is the lead partner because they focus explicitly on older adults who are LGBTQ plus. The others, one is health, one is legal. Some of them are focused on particular subpopulations. Some are focused particularly on Detroit with a higher emphasis on racial diversity. We spent some time trying to think up an acronym for this survey just to have something short and easy, and HOMES is what we came up with, although it's a rather convoluted set of statements there about it. And I am now meeting, I and parts of my team are now meeting with this coalition at least once a month, all on Zoom. And we are getting close to closing the survey and moving on to data analysis. So next slide. Just a little bit of background, and then a lot of the stuff is on the last. For LGBTQ older adults, really originated from the community. And it was from a number of organizations, both in Detroit and other places, and especially among those of color and those who were transgender, of housing discrimination, lack of support, people reporting that if they need to go into care, they're going to have to go back in the closet because they get treated so badly in care facilities. But they didn't know what kind of housing and what kind of support might be needed, and also how it differed by subpopulations and regions. SAGE is Metro Detroit, so it's Wayne County, Oakland, Macomb, and Washtenaw. Only one more minute? Okay, so we should move ahead. The topics are there if you want to know them. And this last one just describes quickly sort of what we're doing. And on this side is the kind of rough task that the coalition started in early 2019. And of course, right at the time you funded us in February, and COVID happened in March. So we got derailed for a while. We piloted a second version of the survey. It went live. My staff was having hysterics yesterday about my barriers to bots and nefarious attacks. They said it sounded like a scary science fiction movie. But in fact, we had to set up a lot of safeguards because LGBTQ online surveys get attacked. And there were examples of like 500 responses in the first hour of people with really nasty and or nonsense data. So that delayed us for a number of months, and we've also had trouble with people putting in invalid responses to get the incentive money. So we've had a lot of things we've had to fend off. We recruited a bunch of ambassadors in addition to the coalition, and they are activists and connectors within the LGBT community. They've been extremely helpful with later stages of development, and we're meeting this afternoon to start working on data analysis. And I also want to say there's 2 pilot projects already underway that the community is doing, but we are in helping them with whatever we can from the data we're getting. There's a new housing project for LGBTQ happening in Affirmations in conjunction with the MCCCD Church. And there's also a pilot project going on with Hannon Center, which is an older adult serving organization, to start doing services and case management with LGBTQ older adults.
And last but not least, our newest grantee, Christina Barros, and her community partner are going to come talk about the work they're doing in Detroit.
Hi, everybody. So amazing to be in person and to not be in front of a screen talking. So thank you for that. My name is Christina Barros. I'm a faculty member here at the school. My research focuses on substance use, and I brought along a member of Southwest Solutions who's going to introduce himself.
Hi, my name is Steve Slade. I was hesitant to take off my mask, but I was mistaken for a student while I had it. So that was pretty cool. So my name is Steve Slade. I'm with Southwest Solutions. We are a nonprofit in Detroit. We focus on 3 essential levels: housing, economic development / job development, and then behavioral mental health services as well. We have a primary focus in Southwest Detroit, but we serve all of Detroit. So Content Detroit Initiative.
Yeah. And so we are here to talk about our project that rose out of a need that Southwest Solutions had, and it's focused really around understanding cannabis use among youth. And the idea of the project really is built on some changing legislations that you might all be aware of. Michigan has changed, among other states in the U.S., changed the use of recreational and medical marijuana, so decriminalizing it. Some of those changes have resulted in greater use among a lot of different populations. And so, but let me tell you a little bit about, besides the changing use, there's also some differing risk perceptions. Cannabis is currently being perceived as less harmful than alcohol. But certain populations have a greater vulnerability for use, and I'll let Steve tell you a little bit about that.
Sure. So one of the things when we're working on job development, we have a lot of technical and vocational programs where we're working on certificates to help people find jobs that might not go the traditional college route. Well, we're finding that no matter how many folks we train, once we get to the drug test, we lose them, and they have to go back and wait until they can pass it, and then they have to make that commitment to stay off of marijuana, despite the legality of it. And people don't understand that even though it's legal, the employers can still have the right to decline employment if you test positive for marijuana. So in addition to just the practicality of finding a job, there are still misunderstood facts about how safe it is and how it can lead to new instances of a mental illness. There's a lot of misunderstandings around how it can impair judgment, trigger psychosis down the road with too much use. So it really connects our economic programs, our job development, with our mental health and substance use initiatives because it deeply affects both of them, which I think when the perception is that it's safe, people don't necessarily connect those consequences.
And surprisingly, there's little information to determine just how much adolescents who are not in the high school system, not in the educational system, are using substances. So we've developed a set of goals for our project that will, together with a steering committee of youth, will adapt materials that will be used for screening and brief intervention and education so that our youth know exactly sort of what the consequences might be and how to be more successful towards their work readiness training. And well, that's it. Thank you. We have 30 seconds.
So if there are any clarifying questions for our three panelists, take a second to do that now. And then, do you want everybody to come up and ask your questions, or are we going? Yeah. So let's ask clarifying questions of these three panelists now, but we're going to open it up for just a conversation across the room. So right now, please, clarifying questions.
This is for the last presenters. Your guys' approach to substance abuse, I'm just curious if it's based in the harm reduction model or the abstinence-only model.
I'd say both. I think, we're certainly, if someone comes in with a marijuana use problem or any substance use, it's certainly not, we're not going to help you. We'll start with where they are and work towards abstinence because, like I was talking about with the jobs, you're not going to get a job if you're using, but we're not going to, if someone's using, we're not going to say, we can't help you, and then that just, furthers the snowball effect of helplessness.
All right, so it looks like we have 6 minutes before we're going to do our networking. So if anybody wants to talk from the audience or ask a question or talk to one another on anything that's happened today, or even about Engage overall, I guess, we can open up a general conversation for 5 or 6 minutes before we break up for more informal networking. So any other general thoughts or questions or things you want to say that you haven't been able to say yet? We'll take a few minutes to open up it to audience.
I have a question about coalition building and how you work with multiple organizations and facilitate shared goals and action around an issue, and what it's like to bring multiple organizations around the table and keeping them engaged. I know, all of you are doing a bit of that. So if you could speak to that, I'd love to learn more.
Thank you. I can talk a little bit about an experience I had. One of my jobs was doing community health organizing and bringing together the competing hospitals in Washtenaw County, along with a bunch of other partners, including the health department. All of them had to do a community health assessment and then figure out what are they going to do about what they learn is going on in our community. And they were competitors. So my approach to doing this coalition building was meet with individuals with each of the organizations first, find out what they care most about, what are their challenges, what are their motivations. That's in my head. Now when they all come together and I hear them talking, I know the context and I can help them find connections and ways that they can work together and point to them look, you all really care about mental health in our community. How can you work with your giant institutions to find things that you can do together to address this? And who's going to do which part of it? And then keeping them engaged was through, typical stuff like emails and things like that, but also making sure to publicly give them credit whenever possible for things that they do together. And really, I have a 5-year-old and I use that with her too. Anytime I notice her doing something that I want her to do more of, just keep on noticing it and she'll keep doing it. And so it worked with the hospitals as well.
Hi, thank you. Yeah. Hello there again. And so since I'm new here, I'm happy to kind of think through that process a bit more. And so one thing as a researcher, I'm always very sensitive to my role and my identity or connection with University of Michigan or just any elite school. And so, I try to kind of explain my role and what my intentions are, but I enter spaces and I just listen. I'm like a fly on the wall. And I always ask permission. I'm like, hey, can I just kind of be in this space before I even start to talk about, I'm interested in this, or yeah, I have 15 years of experience kind of working with refugee populations domestically and abroad, but people don't really care about that. They want to know that you're genuinely there, that you care about them, that you're defaulting to them as the experts. I always use that language. I'm like, you all are the experts. I'm just here to kind of draw on some of my methods training or some things that I've learned here or there. I find that when you default to that, or when you signal to them that, hey, you are guiding this process, you know your experiences better than anyone else, and I'm here to support you, and then, gradually just building those relationships. And eventually we can get to, how can we collaborate? But that takes time. And so everything I just said, I've been here 7 months, I hit the ground running, but I still have so much to do. And so I think when you enter also with that level of humility, like, look, I don't know, I'm going to default to you, and you can guide this process. Let me know how I can apply my skills and the things that I've learned over time to support your initiatives. That's kind of what I've been doing. And once again, there was like a big stakeholder meeting with several refugee resettlement agencies throughout Michigan, and I was like, hey, can I just show up? I didn't say anything. This is not the time for me to use my identity or my role as a professor. It was like, you all do your thing. And so I'll continue to serve in that role, and we'll see where that goes. Thank you.
I just want to compliment that point real quick. And I love nonprofit work. I really do. It's all I've ever done. But there can be a lot of egos involved, and it's kind of managing that without crossing over territorial places or letting them feel like you're telling them how to do their jobs. And then it really kind of goes into doing your research beforehand and letting them know what's in it for them. If you can tell them that, yes, this group combined is going to, like, one of the biggest problems in mental health is frequent hospitalization. That costs the system so much money. So if you can say by working together, you can show you'll reduce hospitalizations that will lead to better rates across the board. You just have to find something that they have in common that they want to buy into. But you have to do that preparation before you meet with them.
I was going to say that I just want to also raise there are a lot of structural issues and leadership issues in working with the coalition. And this project I was just describing, for instance, these organizations were hit hard by COVID, and right in the middle of our trying to launch this thing. So there was a while that I was chairing the coalition, or at least convening it and doing a lot of the facilitating. But what was really important was total transparency. And I got permission from them all to be in that role. In fact, they were begging me to be in that role. And we're now in the process of trying to transition back and set up some subcommittees and create a leadership team within the coalition that isn't riding on me.
There's time for one burning question if we have it. If not, we can break up and do our informal social network. Fatima, you want to tell us how we're going to do that? Yeah, so get a mic. No, get a mic.
So all the presenters do have copies of their slides, and they can just be interspersed throughout the back. If you have something you want to talk about, any work that you're doing that's similar to their work that you might want to collaborate on, anything like that, you can talk with the presenters. There will be food coming in soon that you can take on your way out. Nobody's allowed to eat inside here. And that's pretty much it. And so I will finish passing out the rest of these. So mingle, talk, network with one another or with the presenters